Good morning to all of those who make this broadcast possible, to our sign language interpreter and colleagues on the radio, and to everyone tuned in to this briefing. Today's results are not good. We begin this briefing by reporting the death of 2 people. One was a 78-year-old male patient from the municipality of Arroyo Naranjo with pre-existing medical conditions. He began to show symptoms on August the 13th and was admitted to hospital on the 14th. His PCR test came back positive for COVID-19. He developed complications and was transferred to the intensive care unit on the 19th. And despite showing slight signs of improvement until the 27th, on the 28th he went into cardiorespiratory arrest, from which it was not possible to revive him. We offer our condolences to his family and friends. The other patient was a 56-year-old male, also from Arroyo Naranjo, and suffering from pre-existing medical conditions. He began to show symptoms on August the 19th and was immediately admitted to hospital on the 20th and was confirmed to be suffering from COVID-19. He was transferred to intensive care on August the 23rd and experienced a series of complications from the moment he was admitted. Yesterday, like the first patient, he suddenly went into cardiorespiratory arrest, from which it was not possible to resuscitate him. We offer our condolences to his family, friends, and all those who knew him, as well as to those affected by his death. Therefore, today, 1,057 people are hospitalized in Cuba. 33 are under observation. There are 468 suspected cases and 556 confirmed active cases. A high number which reflects the amount of cases we've seen over recent days. Yesterday, 5,698 samples were processed in our various molecular biology laboratories. 1,840 were processed at the Pedro Curi Tropical Medicine Institute, 735 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 638 in Havana's, 278 in Santiago de Cuba's, 650 in the Genetic Engineering and Biotechnology Center Lab, 374 in the Hermanos Almajedes Hospital, 278 in the Civil Defense Laboratories, 235 in the National Center for Genetics, 225 in the Molecular Immunology Center, 185 in the Fructuoso Rodriguez Hospital, 175 in the Naval Hospital, and 95 in the Manuel Fajardo Hospital Laboratory. These are the numbers of samples processed in each laboratory, and bearing in mind the large amount of cases reported recently, processing will increase in order to quickly detect, isolate, and treat everyone infected with the virus in our country. Of the 5,698 samples processed, 59 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 388,194, of which 3,925 people, or 1.01% of all cases, have tested positive for the virus. As I always mention, samples from all of the country's provinces were tested, the most from Havana, with 4,291, 123 from Artemisa, 152 from Mayabeque, 194 from Matanzas, 223 from Villa Clara, 125 from Ciego de Ávila, 124 from Santiago de Cuba, 96 from Holguín, and so on and so forth from all of the country's provinces. Notice how the number of samples studied depends on the epidemiological situation in each particular territory, or the number of reported cases, which we also know implies a significant number of case contacts and suspected cases which must be isolated and screened. All of the 59 positive cases diagnosed yesterday are Cubans. 43, or 72.8%, are confirmed case contacts. 90.3% of all diagnosed cases, therefore, had contact with someone who had previously tested positive for the virus. Of the 59 cases diagnosed yesterday, the source of infection linked to 6 is yet to be determined, for a total of 23, or 0.5% of cases of this kind over the last 15 days. Yesterday, 10 of the 59 people to have tested positive for the virus contracted it abroad, for a total of 362 imported cases. These individuals arrived in Cuba, were taken directly to isolation centers, tested for the virus, and confirmed to be suffering from COVID-19. Of the 59 diagnosed cases yesterday, 36 are male, for 50.3% of all cases. Meanwhile, 23 are female, representing 49.7% of all diagnosed cases in Cuba. 41 of the 59 cases yesterday were asymptomatic at the time of testing, representing 69.4% of the total. When we look at this figure since the start of the pandemic, we can see that 2,281 people, or 58.1% of all confirmed cases, have shown no symptoms at the time of testing. By age group, 5 positive cases diagnosed yesterday are under the age of 20, 4 of which are under the age of 18, for a total of 405 children, or pediatric cases, to have tested positive for the virus in Cuba, the majority of whom have responded well to treatment, with 90.4%, or 366 of the 405 cases, discharged from hospital. Meanwhile, 28 people diagnosed with the virus yesterday are between 20 and 39 years of age, 19 are between 40 and 59, and 7 are over the age of 60. As I mentioned, of the 59 positive cases yesterday, 10 are imported. 2 are from Pinar del Rio, 1 is from Artemisa, there is 1 case from Havana, 1 from Matanzas, 1 from Villa Clara, one from Sancti Spiritus, one from Camagüey, another from Holguín, and one from Granma. Let me stress that these individuals have not set foot in their province of residence, and therefore do not count toward its overall confirmed case rate, nor are they the result of local transmission in the country. The 49 remaining cases are all autochthonous. One belongs to the municipality of Mariel in the province of Artemisa, one to Cárdenas, Matanzas, two in Ciego de Ávila from the municipalities of Ciego de Ávila and Venezuela, and 45 belong to Havana. There are 7 each from Marianao, La Lisa, and 10 de Octubre, 6 from Arroyo Naranjo, 4 from Boyeros, 4 from Habana del Este, 3 each from Centro Habana and Plaza, and 1 each from Regla, San Miguel, Cerro, and Habana Vieja. As you can see, there are cases in almost every municipality in the city. Yesterday's results per province therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 24.03. Artemisa follows with a rate of 9.52 per 100,000 inhabitants, lower than yesterday's rate. Then Pinar del Rio with 5.14. Matanzas rate rises to 3.61. Villa Claras drops to 1.41. Las Tunas has a rate of 1.31. Ciego de Ávilas rises to 1.60. Mayabeques stands at 0.26. Then Camagüey with 0.13, similar to yesterday's figure. This means that Cuba has a rate of 5.76 per 100,000 inhabitants over the last 15 days. These figures show just how complicated the epidemiological situation in the country is, and why certain measures have been adopted. To summarize, of the 3,925 people who have been diagnosed with the virus thus far in Cuba, 556, or 14.1%, are active hospitalized cases. 534, or 96%, are clinically stable. As I stated at the beginning of this briefing, we regret to report the death of 2 patients yesterday. This brings the COVID-19 death toll in Cuba to 94. This means that the island has a mortality rate of 2.39%, which could seem low when compared with the global rate of 3.39% and regional rate of 3.52%. However, for Cuba, 2.39% is high, and is why we are working to reduce this figure. That is why it is so important, in addition to treatments and protocols which are continually being updated, as well as the use of new medications and new ways of administering them, to contact your local doctor as soon as you have symptoms of the virus, or if you don't, but you know that you've been in contact with a person who has tested positive for the virus. Cooperation in this sense is vital. People of a certain age with pre-existing health conditions must make sure that they are protecting themselves, as should their families. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 51 people were discharged from hospital, lower than those who tested positive for the virus. This means that to date, 3,273 people, or 83.4% of all confirmed cases in Cuba, have recovered from the virus. Today, 5 patients continue to be in a critical state, with 17 reported as serious, all of whom are from Havana and are being treated in intensive care. Yesterday, 2 patients joined the group of those reported as serious, and 1 serious patient passed to closely monitored. However, these numbers are still high, and our intensive care professionals are working hard to reduce the amount of critical and serious patients. Now we're going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 269,157 people were diagnosed with the virus, for a total of 24,473,843 confirmed cases since the start of the pandemic. Yesterday, 5,912 people died of the virus, for a total of 832,002 COVID-19 fatalities and a mortality rate of 3.39%. The region of the Americas accounts for 53.26% of all COVID-19 cases worldwide and reported 126,439 new cases yesterday, for a total of 13,036,986 confirmed cases. A high number of deaths were also reported in the region yesterday, 3,547, bringing the COVID-19 death toll in the Americas to 459,113, and a mortality rate of 3.52%. Just like yesterday, the United States continues to top the list of countries hardest hit by the pandemic, with 5,867,785 confirmed cases and 180,824 COVID-19 fatalities, 1,110 of which were reported yesterday. Next comes Brazil with almost 4 million positive cases. Then India with 3,387,000. These are the top 3 countries with over 1 million confirmed COVID-19 cases. As you can see, these numbers are not dropping, while fatalities also continue to rise. Yesterday, 1,057 people died of the virus in India and 984 in Brazil. This is the information that we have on the behavior of the pandemic in Cuba and the world.